Hi, I'm David Knopfler. I'm a physician at Overlake Hospital and Chief Medical Officer for Overlake.
Hi, I'm Tom Miller.
So my name is Dr. Eric Shipley. I'm the Medical Director and Chief of Emergency Medicine here at Overlake Hospital. I've been here 19 years.
My title is Medical Director of Quality and Safety. I've been an emergency physician at Overlake for 37 plus years. I just retired from that position, but now my job is to monitor quality and safety from a medical standpoint here at Overlake.
Wanted to show you a little bit about our emergency department, what our volumes are doing, what patients we're seeing, how are we dealing with personal protective equipment, both the challenges and reusability, and to get a sense of some of the great work that's taking place and some of the people in the community that are helping us.
I want to introduce you to all of the amazing things that are happening at Overlake around the COVID crisis. We have stepped up to serve our community, and I'm so proud of both our hospital staff and the community for their response.
So I got a phone call on February 29th at 12:30 at midnight from one of our infectious disease specialists that we had the first COVID case at our hospital, which coincided with the first U.S. COVID death at Evergreen, just to the north of us.
I actually happened to be working the night we got our first patient. And it was February 29th, and all of us have already stated it's a good thing we only have to remember that day every 4 years.
So, number one, we're doing a lot of work that isn't visible to the community perhaps, but things have changed here pretty dramatically, but I feel as though I can reassure the community that we were on the ball immediately.
It was a wake-up call. It was one of those phone calls I'll never forget. And knowing that over the next 12 hours there'd be public information about this.
That first night, you know, it was very scary. This was something we'd all been expecting, but it came sooner than we thought because of Life Care Center up in Kirkland. Our first patient was a staff member, a nurse actually from Life Care Center. I think, again, we had prepared for this, but preparation and reality are often two different things. We performed very well, and I can say in that first case we didn't have a single staff member that was exposed.
That changes the whole picture when you're immersed in the middle of the crisis, as opposed to seeing it occur elsewhere and imagining what you would do. This is reality for us now.
I think folks are actually doing much better now than we were 3 weeks ago because we've learned to adapt to it. The testing's more logical, the capper and the personal protective equipment is helpful so that we're able to at least project a little bit what we need to do.
So different types of fears. If I compared them, I'm far more worried right now. We have not had a shipment from our vendors for over a week. We're actually maybe getting on 2 weeks for some things, and even 3 weeks in others. We've not received any government supplied materials supplies at all, zero. We've had to be very creative, and I'm holding a paintball helmet and goggles, which is highly effective and anti-fog. Which is wonderful. It can be worn over the protective N95 mask, which is great. This is exactly the type of creative solutions that we're looking for.
Volumes in emergency departments, paradoxically, are actually quite a bit lower in our community than people expect them to be. Even though we were the first outbreak, even though we had more deaths than anywhere in the country, now, a month into this, we actually have volumes in the emergency departments that are quite a bit lower, significantly lower than our normal, which is really surprising. So the message to patients is really, if you need emergent care, please come, don't delay that.
It's not mayhem and chaos. I know there's a lot of attention to that. It feels like through some of the stories that are out there that this is sort of an uncontrolled situation. I would say there is enormous fear over the numbers, right? I mean, we all know that there are going to be a lot of patients that have COVID. However, if you approach it carefully and thoughtfully and have a very robust emergency planning, you can create order that keeps everybody on a more level playing field, keeps the morale up.
It's also interesting that different regions of the country are having very different experiences. So our test rate in King County in Washington State is about 7%. So if 100 people come in, 93 are negative, right? Really, really important number. Whereas in New York, their test positive rate is 24%, right? So it's it is 3 to 4 times greater than ours.
Donations do make a difference, right? We use all this equipment. We need the equipment. We have it ordered, we have it stocked, we validate that it's safe to use, and it is getting used. So I don't want anyone to think that this is going to waste, because it all is extraordinarily helpful.
Look at that. And these are these are gloves?
There's some like regular masks.
Earlobes?
in there, yeah.
Wow, look at
And then I
that.
gave some other ones here. So.
Okay. So the community's been very generous. The heroics of everybody, and this isn't just the physicians, this is the cleaning staff. They're at big risk, at the admitting folks, the techs. It's been really a pretty remarkable experience to see how people respond to tragedy, even though they're putting themselves out there.
The Seattle area, I think, has done a very good job. Nothing's perfect, but done a really good job of social distancing.
The phrase cautiously optimistic is what I'm trying to give folks. There is some optimism, there is some gleam of hope out there, despite all of the challenges we're having in the ICUs and with ventilators and nationwide.
We'll make it through this together, be positive, and we'll take it day to day and do what needs to be done. I think we'll be stronger as a result of having gone through this.